welcome back to the Oral Health Podcast. We've discussed already the State of Mouth Cancer report being released and the risk factors for mouth cancer. Now, continuing the Mouth Cancer Action Month conversation, we're going to have a chat about the different symptoms you can experience with a mouth cancer diagnosis. Karen obviously joining me again, as always. And let's just get straight into it because there's a few different things we could cover. So
there's certain things that you can look out for, some more obvious than others. Essentially we are looking at lumps and bumps anywhere. You're looking for anything that sort of has a lump or something that comes up and doesn't go away. Red or white patches inside the mouth, and ulcers that haven't healed within 3 weeks.
Mm-hmm.
So those are the main ones that we're looking for. Now, you might not notice, which is why we need to check once a month.
Yep.
We need to have a look in our mouths, lift a tongue up. There is a way to do it, and I'm sure it's on our website, isn't it? How to give yourself a mouth cancer check.
Definitely.
And, it's something that we do for a lot of other things, so it should be part of that routine. So you're looking for anything that is different for you. Now, I've had people phone me up and in a panic saying, oh my goodness, I've got like a big purple thing underneath my tongue. Well, that's probably the vein in your tongue, it's probably nothing to worry about. But so we're looking for changes. So have a look at your mouth in detail, because you probably have never done it before. If you've got a nice light or even a mouth mirror, brilliant.
Mm-hmm.
But a lot of it is done by feel.
Yep.
So you want to feel underneath your chin. I'm doing it now and I shouldn't be doing it because I could put my arm over the mic. So you're feeling underneath your chin all the way round, feeling down into your throat, across your neck and upwards up towards your ear. So you're feeling all the way along there, all along the jawbone, all the way along.
Every surface.
Now, there shouldn't be any lumps there. If there's a lump there, we'll
have a look. Yeah,
we'll get
but
that
it can
checked
happen
out.
with other things as well. Like you can get lumps in your neck. What I was told is feel for a lump about the size of a baked bean.
Yeah.
But you can get lumps from like swollen glands.
Exactly.
You've got a cold.
This is why we're saying 3 weeks.
Yeah.
So do that. Then you want to open your mouth, get hold of your tongue. It's a slippery little blighter, so you might want to get a piece of gauze or something like that to get hold of the end of it. You can then pull your tongue out, you can look underneath it, you can turn it round, you can look towards the back. Even better, as I say, if you've got a little mouth mirror. So have a look at that. Because nobody's mouth is the same, so don't compare yourself to your partner's or your child's or anything. You're just looking for you.
Yeah.
So you want to be looking there. You then want to get your thumb and your forefinger, finger inside the mouth, thumb on the outside of your cheek, and you're going to feel all the way up and along, all the way along your lips each side, just to see if there's any changes there. You're then going to actually visibly look all along your gums, outside, inside, floor of your mouth, and on your palate. It might take you a long time the first time you do it, but as you get more au fait with it, do it. If you want to do like a little mouth map, I think we probably have those as well.
I think
do we?
so, yeah.
So it looks like a U ironed out flat. So if you notice that you've got something, lots of people have a line on the inside of their cheek where their teeth come together.
Mm-hmm.
That's almost like a callus.
Yeah.
Now that's nothing to worry about, but you can draw it on there so that you can check it next time, see if it's the same. A lot of people cheek bite. That's not going to cause cancer, but it might make the inside of your mouth look a little bit peculiar.
Yeah.
But you've just got to put it down and say, it's a habit I've got. I'll try and stop it. So those are the kind of things that you've got to get to know your own mouth, like you know your own body. You can, look at your own mouth. So the basic ones, as I've said before, are any lumps and bumps, red or white patches, or ulcers that haven't healed within 3 weeks. Get yourself to your dentist if you experience any of those, or if you're at all worried about something, go to your dentist. If you haven't got a dentist, I know in some cases it's quite difficult at the moment. Go to your doctor, explain the symptoms that you've got. if they are at all concerned, and I would expect every GP to probably refer, because they don't really, they're not as experienced in the mouth, but a dentist might be able to tell you that's because you've got a broken tooth and it's rubbing, or certain things like that.
They know all these things to look for.
Oh, absolutely. And if they are at all worried, you will be referred on a 2-week referral. You will get in to see somebody. The sooner it's caught, the easier it is to deal with. The less complex is the treatment, the reconstruction, the amount of radiotherapy and chemotherapy you have to have. It's all much easier to deal with the sooner you get it. So don't put it off. Don't say, I'll just wait another week. Like we are all tend to do that. So we've talked about the really, really basic ones, the ones that we really want to look at, that come to mind all the time. Slightly rarer is a persistent hoarseness, which is normally cancers that are further down into the throat and the tonsils. But not to be ignored, because in the tonsils is the most common place to get mouth cancer.
Yep.
So any hoarseness of the voice, persistent, get that checked out. And if you stick your tongue out and it doesn't stick out straight, if it goes to the side or up or other side, that is also another sign. So any sort of calluses or any sort of I don't know how to describe it, because you can't say it's scabs, is it? Because it's in the mouth, it doesn't scab. But any wound that doesn't heal,
or like a hole.
Yeah, anything like that. Because I've known tongue cancers to just be a hole at the back of the tongue that it's sore if you get something stuck in it or acidic or whatever. It's a bit sharp. So things like that. But that's what I say. I mean, it could be any of those, but any change in your mouth is what you're looking for. So it doesn't have to be one of those on the list. I wouldn't want people to say, well, it's not like that, so I won't go.
Yeah.
It's something different.
Yep.
Those are the main ones, but it's not exhaustive, that list. So that's why we say, check once a month. Any changes that are different to you, for you, go and get it checked out. As I've said before, your dentist, the specialist that you referred to, would rather see 30 people that it's nothing to worry about, just to catch the one. It's so much better to do that.
Yeah.
A lot of most cases are diagnosed at a later stage 3 and stage 4. So we really want to reduce that and get people at an earlier stage where it's much easier to deal with, and you've got a much better chance of a better quality of life afterwards.
Absolutely. And, it's really important as well, you're saying about getting to know your own mouth, not comparing it to other people's. Like, I went and did a video last year, getting a mouth cancer check on myself. And afterwards, the dentist kind of pulled me aside and was like, you do have a white patch along the side of your tongue. I don't want you to watch it back and be like, oh my God, because what it is where the tongue's been rubbing against the teeth. And I was like, thank you for telling me that, so that I don't then go home and go,
Well, when you go in for your dental checkup, whether you go 6 months, 9 months, 12 months, 18 months, the dentist is doing a mouth cancer check.
Yeah.
Now, many of them don't actually flag it up to the patient, but there's no reason why you can't say, are you doing my mouth cancer check now? So you will notice that your dentist has got his hands on your face, and you think, oh, I wonder what they're doing now. But that's what they're doing, and then they're looking inside and looking around. But you can certainly say, have you done my mouth cancer check? What did you think, or anything like that? And say to your dentist, I do check every month. They will be really impressed.
They will. They really will.
Now it's very strange, because if I put my tongue out, it will look totally different to yours, Sophie, because I've got dry mouth. Now, dry mouth makes your tongue really pale and very different looking to many people's tongues. So it's normally medication that causes it. So you can ask your doctor to try and change you to another one. It's not really possible because there's hundreds of drugs that cause it. Mouths do get drier with age as well.
Yeah.
But yeah, I mean, if you've got that kind of problem, it's slightly different. But if you do think that you've got a dry mouth, if your tongue's very pale, then you can also speak to your dentist about that, and they will be able to give you something to relieve it.
Yeah.
So dry mouth is not a symptom.
Yeah. You know, it is normal as well. To some extent, it is normal to have lumps and bumps. You're not a Barbie doll. You're not going to have perfectly smooth jaws or like down your neck. You're not going to feel nothing there. And like, you know, if you feel like I've got my jaw's a bit funky, so it clicks. But then if I was like, oh, that feels a lot bigger than normal, it's like, just keeping track of your own.
It is, definitely. And like I say, if you've actually drawn a picture of your mouth, you can kind of go, oh, well, that wasn't there before, because you've drawn where you felt a little nobble. But, you know, like you say, we're all different. So just check.
I don't know if this question is maybe a little bit left field, but we'll see. Because obviously when you check for breast cancer and you feel for lumps and bumps in the breast, they kind of tell you to do it at the same point every month so that your cycle isn't interfering with... There's nothing really like that with mouth cancer.
No.
You can... there's nothing
Unless
that's
you're
going to...
ill. This is why we say 3 weeks, because you're unlikely to be... If you're ill for longer than that, then you really should be getting checked out anyway for other things. But... yeah, I mean, if you feel and you think, oh my goodness, I've got a lump here, and then you think, well, actually, I'm not very well, that's probably the reason that your glands are up. It's the first thing the doctor does, isn't it, when you go in to say, when you say you're ill. I know, you go in with an ingrown toenail or feeling your throat. Or perhaps he's trying to strangle me. Maybe. But yeah, so it is important to just be sensible about it. And you know, I don't want anybody to go, well, I'll just leave it for a little bit longer. Just go.
Yeah. Just get it sorted.
Just go. Even if somebody could say to you, no, that's absolutely fine. You know, you're not going to have the sleepless nights and the worry, and you know, that's no good for us.
Yeah.
Stress.
And then you've also got a base mark of what is fine.
Yeah.
And then it will be easier to keep track of if
it is much easier.
Yeah.
Yeah, it is much easier. The more you do it, the more you know your mouth, and you know what your mouth looks like. I mean, I know that I've got a ridge across on my side of my tongue. I know that I've got that, so that doesn't bother me. You know, I've seen the dentist.
Yeah.
I check. She checks. So
there you are.
But
just keep on top of it. That's the main thing. Keep on top of it. Keep on top of any symptoms you've got, any lumps you feel, any patches you see.
Reduce your risk factors.
It really can save. Look
out for symptoms. It could save your life. And if you're in doubt, go and get it checked out.
Absolutely. Now we're going to hear from our ambassadors over the next few episodes you'll listen to, as well as a few professional guests as well. So stay tuned for that, and we'll speak to you shortly.